im se svima, i malima i velikima, i bogatima i siromašnima, i slobodnjacima i robovima, dade žig na njihovu desnu ruku ili na čela njihova, te da nitko ne može ništa kupiti ili prodati, osim onoga ko ima žig ili ime zvijeri ili broj imena njezina.
Pozdrav dragi narode, dobrodošli u još jednu epizodu Slobodni. Današnja tema su cjepiva protiv HPV-a. Naime, sad znamo svi da naša vlada planira uvesti ta cjepiva kao obavezna od iduće godine. Zato sam odlučio da malo istražim o čemu se radi i da uđem dublje u temu. Da istražim kako su i nastala ta cjepiva, koja je pozadina i kakva je uistinu kvalitete tog proizvoda. I tražeći tako sam uspješno pronašao nekoga ko se dugi niz godina bavi tim i koji je napisao i izvrsnu knjigu koja opisuje sve ono što je važno da znate. Knjiga se zove HPV cjepiva na suđenju, potraga za pravdom za generacije koje su izdane. A da ne duljim puno, danas ćete čuti puno detalja oko tih cjepiva i čast mi je predstaviti autoricu knjige, gospođu Mary Holland. Hello Mary, welcome to our show in Croatia.
Thank you so much. Pleasure to be here.
Just say us first a few words about your book, and then we'll continue as we have lots of things to discuss about.
Sure. So already almost 8 years ago, in 2018, I co-authored with two others a book called The HPV Vaccine on Trial, Seeking Justice for a Generation Betrayed. The book was really about the HPV vaccine that had by then been on the market for a few years, and we were hearing about devastating injuries and deaths of teenagers around the world and protests around the world about the HPV vaccine. And I had already investigated connections between vaccines and other harms, including autism. And I felt compelled with my colleagues to look into this. And I'm happy to talk to you about what we found. We researched the book for several years, and the book actually did lead in part to litigation against one of the manufacturers of HPV vaccines.
Just a few weeks ago, I had a chance to talk with one lady. She's a doctor, and she's promoting vaccines against HPV. And also she says in this interview, and we will see this interview in a minute, that she suggested to our government to put this vaccine as a mandatory. Then I tried to ask her a few questions, and now we will see what happened. Možete se samo predstaviti za moje gledatelje, doktorica?
Neda Ferinčić-Urban, glavna tajnica Hrvatske lige protiv raka.
Danas sam čuo da se priprema predlog zakona za iduću godinu da se HPV uvode kao obavezno cjepivo. Je to točno?
Prijedlog je, vidjet ćemo kako će proći u prijedlogu zakona, pa ćemo vidjeti nakon što se prođe savjetovanje, pa nakon toga ćemo znati točne informacije, a za sada bi to prepustila Ministarstvo zdravstva.
Dobro. Imam pitanje vezano za cjepivo protiv HPV-a. Ja sam prije mjesec dana, a i prije godinu dana, imao intervju sa gospodinom Aaronom Sirijem. On je inače odvjetnik Roberta F. Kennedya Jr., sadašnjeg ministra zdravlja Amerike. I pitanje na HPV i pitanje na cjepivo, to je u pitanju bilo Gardasil, da li je napravljeno testiranje na sigurnost. On mi je pokazao sa stranica FDA da prilikom testiranja na sigurnost nisu korištene double blind controlling trial, to znači slijepe skupine placebo, nego su korištene skupine u kojem je jedan bio adjuvant, aluminijski, a u drugi je bio cjepivo. I na tim rezultatima pokazano je da je to 2,3% žena u dobi od 9 do 30 godina je imalo autoimune bolesti u roku 6 mjeseci. Da li znate nešto o tome?
Znam da to nije točno. To je sigurno da nije točno. Placebo se uvijek koristi u kliničkim istraživanjima i to je cjepivo koje je podijeljeno u svijetu 948 milijuna doza i nije prijavljena niti jedna nuspojava, pogotovo ne autoimunih bolesti. Kod autoimunih bolesti dapače preporučuje se cijepljenje protiv humanog papiloma virusa jer stanice mutiraju i nisu sposobne stvoriti imunitet protiv humanog papiloma virusa.
Da li ste čitali te stranice FDA gdje to piše? i kažete da to ne piše.
Ne.
Čak i moj video na koji se to...
Ne, placebo je 100% napravljen i to je jedno od najsigurnijih cjepiva koje trenutno postoji.
Gdje možemo dobiti studije u kojima se pokazuje to što tvrdite?
Na našem, što se tiče Republike Hrvatske, ja bih preporučila stranicu Halmeda.
Ali ko je proizvođač cjepiva?
Proizvođač cjepiva je MSD, Merck.
Dakle, nama treba od Amerike to.
Znači, nama treba za hrvatsko tržište naše preporuke, koje su preuzete od europskih i svjetskih smjernica.
Na kojoj stranici se može pronaći točno te izvode? Halmeda stranica. Inače, bilo je saslušanje u Senatu. Gospodin senator Ron Johnson je saslušao, s jedne strane je bio Aaron Siri, s druge strane je bio Jake Scott. Jake Scott, koji je tvrdio isto što je vi, da postoje provjerene studije, je ponudio 1700 studija, od kojih su 661 bila upravo to što oni tvrde. Međutim, u analizi tih 661 studija pokazalo se da niti jedna nema placebo kontrolnu skupinu, već je usporedba uvijek jednog cjepiva koji se testira i prijašnje verzije tog istog cjepiva.
Oprostite, vi ste mene sada intervjuirali da me provocirate ili što?
Ja navodim službeno što je bilo u saslušanju u Senatu.
Dobro, mi nismo
napravio sam emisiju. A tamo se pod prisegom, a ovdje ne.
Kako ne pod prisegom?
Dakle, tamo se pod prisegom govori, a vi ne govorite pod prisegom.
Ja govorim pod prisegom da je cjepivo apsolutno sigurno. I to je ono što iza čega ja
Ali
stojim.
zašto mislite da, znači nećete više razgovarati? Ali da li to znači... Pa problem je u tome što sam ja naveo izvore američki senat, stranice FDA-a. Ja na to pitam gospođu, ona kaže da to nije točno. Ja kažem, imate li podatke koje pokazuju da nije točno? Oni kažu da imam. Ja kažem da se o tim podacima razgovaralo na saslušanju kod senatora Rona Johnsona, u kome je Jack Scott ponudio te podatke, ali Aaron Siri je pokazao da nijedan od tih podataka nije ono što on tvrdi. I gospođa je samo napustila razgovor.
Pa dobro, očito ste možda malo preagresivni.
Ne, nego ja postavljam pitanja, a gospođa kaže ne. Gospođa kaže, nije točno što piše na FDA stranicama. Pa sad ja pitala se zašto ona može reći da nije točno, a pritom ne ponuditi dokaz za to.
Ne znam, evo tu smo slobodni, da svi zajedno probamo dati podršku oboljelima i raditi na prevenciji.
To je PR, ali dokazi na sudu su nešto drugo. A ja sam se bavio upravo, pa obratio se jesam, Aaron Siri, dakle odvjetnik, da, i opet prekid razgovora. Dakle, kad god dođemo do dokaza, prekid razgovora. Evo, tako da. Evo gospodo, imali ste prilike vidjeti. Kad dođe do pitanja da ja postavljam dokaze za ono što ona tvrdi, ona se pokupi i kaže odite na Halmed. Na Halmedu naravno nema ničega toga, jer kaže nju zanima Halmed, iako to američki proizvođač cjepiva. Evo, to vam je danas ono što vam službena medicina, znači gospođa radi kao službeno, sad nisam siguran, ona se predstavila, vidjeli ste sami. A onda kad ja tražim dokaze, ona kaže da ja hoću provocirati. Dakle, možete razgovarati samo ako je u skladu sa službenim narativom. Ako imate pitanja koja su neugodna, onda ste provokator, onda vas napuštaju. Evo toliko. Ovo će naravno danas ići na stranice, pa sami zaključite. This video became viral very soon and it had 100,000 views just in one day. What is your comment on this statement about this lady, and she's a doctor, as she's presenting a Croatian league for fight against cancer, is saying?
Andrea, the HPV vaccines have never been proven to prevent a single case of cancer of any kind anywhere in the world. That's what people need to know. The clinical trials for the Gardasil vaccine used basically fake endpoints. They couldn't wait to see if cancer would develop. And so there's no proof that these actually prevent cancer. I'd also say that in the United States, when initially Merck brought out the Gardasil vaccine, an HPV, human papillomavirus vaccine, they tried to mandate it in Texas, and the pushback was so overwhelming that they have never tried since to make it mandatory in the United States in any place where there was not some opt-out, personal belief or religious opt-out right, or just any opt-out right. So I think that there's no basis for a mandatory HPV vaccine. And as we'll discuss, many people have been severely injured and have died from this shot.
Yeah, she said that it's very safe and that was 948 million doses mandated, and that there was no any adverse event. But I would like to show some pictures that you sent me and that are in your book. And I would like to please tell us who are these people that we are seeing in book.
Yes. Okay. So Alexis Wolf was a beautiful young teenage girl, and the shots literally made her regress to the level of about a 2-year-old. She became lethargic and unable to talk and unable to do any of the things that she had been able to do before. So the next picture is of Chris Tarcell, who died after the third Gardasil dose. She was a lovely young woman in college. She had her future ahead of her. Her mother, Emily Tarcell, is a good friend, and Emily fought in the injury compensation program in the United States and proved in that limited court that the reason that Chris died was because of the Gardasil shots. She died of a heart attack. So the next pictures, there's 4 actually, of a remarkable young man, Colton Barrett. His mom, whom I met, was told that this would protect his future wife from cancer. Very, very religious, devout family. And they thought, sure, of course, I assume the doctor's telling me the truth. Colton basically became paralyzed, and then he could no longer activate his own lungs. And so he was put on basically like an iron lung that he carried around with him.
Yes.
Yeah, so Colton had this machine that he had to carry wherever he went. His family had to take care of him all the time. He was a teenager. And so on a very rare occasion when his family was gone, he felt like he was a burden on his family, and he removed the breathing tube and he died.
He committed suicide.
He committed suicide because the burden he felt that it placed on his family was too great. Horrible.
Next picture, please.
Next one is another young woman, Maddie Mori, and she suffered from the injuries of HPV vaccine. She developed this sound in her head that she could not get to go away. And she also took her own life at 21. She couldn't stand the pain.
She also committed suicide.
She also committed suicide. And again, these are families that know these children. They would never have committed suicide but for their severe injuries.
Please, the next picture.
So the next picture is of Joel Gomez, an adorable child and young man. And he died of a heart attack after his second Gardasil shot. And Andrea, as we know from the COVID shots that caused heart attacks, myocarditis, pericarditis in young men, it's largely the same phenomenon. It's this extreme jolt to the immune system. And Joel died immediately after his second dose in his sleep.
How old was he?
And these are ones that we collected, Andrea, before 2018. Andrea, at the end of the protests around the world in Ireland, in Colombia.
Last picture, please. Last picture, okay? Yeah, we see this. This is protesting, you said, in Colombia.
Colombia is the bottom, Ireland is the top. The injuries have been so severe around the world that people have had protests about them.
Well, Mary, can you tell us how we know that these deaths and this tragic situation are from HPV vaccine?
Andrea, people are intelligent, and when your child is perfectly healthy and then they develop some kind of weird, debilitating symptoms, rashes, ear infections, flu-like symptoms, or tics or paralysis, and then they get another shot and the child is paralyzed or dies, there's not much question that but for those shots, they wouldn't be in that situation. But there's also biological mechanisms that are understood, including there's 2 main huge problems with the HPV shots. There are many, but one is that they use a novel aluminum adjuvant called AAHS. It's got aluminum in it. Aluminum is a poison. Aluminum is used in shots to wake up your immune system and to make it react against the antigen. So Gardasil had 4 strains of human papilloma viruses, virus-like particles. They're fake particles. They're genetically modified. Gardasil 9 has 9 particles. But in addition to those particles, which in and of themselves might make people react adversely, there's also proven DNA contamination in these shots. Again, much like in the COVID shots, there's proven DNA contamination. That is very serious. It was not accepted by the FDA. It's not what they said would be in there. And there are all kinds of injuries that have occurred because of the HPV vaccines.
In your book, you're writing about clinical trials, and you give us samples of 2 ladies, 2 girls from Denmark.
Right.
How they went through these clinical trials, but they were not aware that they received something they didn't know, and they found out later, and they said they had some adverse reactions. Can you tell us these details about this story?
We just have to remember, Andrea, that the pharmaceutical industry makes billions of dollars, and they make billions of dollars by assuring people everything they do is safe and effective, safe and effective, safe and effective. So before it came on the market in the United States, there were clinical trials in Denmark. 2 young women were going to get a few $100s. They were students. They thought, great, I'll get some money. They were told in their documentation that the shots had already been proven safe. That was a lie. It also said that the placebo in the control, in the experiment, was going to be salt water. Saltvand was the word in Danish. That was also a lie. They never, in the clinical trials, they did not use true placebos for any group. And we can come back to that. And both these young women developed very serious adverse reactions, which they didn't really understand because the people in the clinical trial, the healthcare practitioners, didn't understand that they were adverse events. So they both had severe autoimmune conditions that lasted for many years. They had to drop out of school. They had to drop out of their work. It had huge, huge adverse impacts on their lives. And they ultimately, through a film that was shown in Denmark, they met one another. They created a kind of a support group. Very fortunate in Denmark, Dr. Mielsen actually put together clinics for all of the young people who were injured by the HPV vaccines, and there was some medical assistance for these people.
You want to say there is even a clinic specialized for injured from HPV vaccine in Denmark?
Denmark, 5 clinics were set up around the country specifically for the young people who had been injured by these shots.
Can you explain us in details what they made wrong during the clinical trials about first, second, third, and then after that, how they decided to end trial, do it, I think, I'm talking about these lesions. They decided that want to stop these lesions, not really cancers. These details are very important because here in Croatia, we believe documents from EMA, European Medical Agency. European Medical Agency receiving documents from the producers. But background, how they came to these documents, that is the thing that you explore and you put in the book. Please explain us.
So the clinical trials, Gardasil is the primary HPV vaccine in the world. Glaxo also has another one called Cervarix, but our book is primarily about Gardasil. And at that time, when this was going through the Food and Drug Administration in the United States in the early 2000s, they had just developed a fast-tracked procedure. We explain in the book that we don't believe that Gardasil should have been fast-tracked. Fast tracks means that they want to get a new medicine onto the market because there's nothing similar. There's nothing that does this wonderful thing that this new drug does. Well, there is a screening test. This shot is supposed to prevent cervical cancer, first and foremost. Pap screening absolutely works, right? Women go in every year, every 3 years. They look at the development of cells in the cervix inside, at the top of the vagina, at the bottom of the uterus, and they can tell if there's abnormal growth. So there was absolutely an alternative. Anyway, probably money talked in some way, and they fast-tracked this. So this was a very short period for the clinical trials. Cancer, cervical cancer in particular, typically takes decades to develop. The average age of a woman to get cervical cancer up until the advent of HPV vaccines was in her 50s. It was a woman who was not going for Pap screening. There were other risk factors like lots of pregnancies starting very early in life, smoking, lots of sexual partners, poor nutrition. Those are all the red flags that might predispose you to get cervical cancer. It's not a common cancer in the developed world, especially where women are going for screening. So they couldn't wait 30 years, Andrea, to make their money back. So they said, okay, we're going to look at cervical lesions. We're going to look at cervical intraepithelial lesions, CINs, which they have in different stages. The most important thing for people to understand is that the vast 99% of these cervical lesions disappear on their own. You have better nutrition, you stop smoking, you live in a better environment, it just disappears. It's very rare for these lesions to lead to cancer. But the clinical trials pretended as if you reverse the lesions, it's a proxy, it's the same as preventing cancer. That is a totally frankly, irrational assumption, but that's what the clinical trials did. But even more frightening and dangerous than that, Andrea, what the clinical trial data actually showed was that women who had active viral infections, human papilloma viral infections, or even if they had already cleared the infection, but they had antibodies to these 4 viral strains or 9 viral strains, they were more likely to reactivate that viral infection. And so literally in the clinical trials, there's information that shows that it reactivated the lesions or their cancers. And one of the many things that we've seen and reported after this came on the market is women would develop cervical cancer after taking a vaccine to prevent cervical cancer.
That means there were negative efficacy.
Exactly. They call it negative efficacy, which means basically it's giving you a new thing. Another incredible thing about the clinical trials is such a huge percentage. So they also... Sorry, getting me going. So they didn't use, even though they pretended as if they used a true saline placebo in a very small group, they didn't even use a true saline placebo for any group. They used all of the things in the solution. They used the aluminum, they used the sodium borate, they used all of the things, and they just took out the viruses. And then in another group, so one group they kept in the aluminum, another group they took out the aluminum and they took out the antigen, but they still kept the carrier solution. So there wasn't a single group in the 20,000 that they used that had a true placebo in it. But so many of the girls, and in the clinical trials, it was almost all girls, not exclusively, and they were older than the group that actually was given the shots. But in those groups, there was a very high percentage, about a third of these young people would develop autoimmune conditions. So whether it was rheumatoid arthritis or it was called POTS, postural orthostatic tachycardia syndrome, or lots of different kinds of respiratory issues, gastrointestinal issues. They were developing what Merck then called new medical conditions. Instead of saying these are adverse effects to these vaccines and to the aluminum in the vaccine specifically, they called it new medical conditions, which again, we believe is just fraudulent. These were adverse events that weren't characterized as that. Another thing that they did to kind of game the clinical trials is they would have very small groups around the world in different sites, so that instead of one doctor or one team of doctors having 1,000 people and they could readily identify, oh my gosh, several people, a huge group are getting these problems, it would be spread out so they couldn't really tell what was happening. Many things were done to make sure that this new vaccine got onto the market, even though there were very, very serious red flags that there were real problems during the clinical trials.
And you're writing inside about a fertility effect. What signals concerning fertility you noticed in these clinical trials?
So they asked for women not to be pregnant when they came into the clinical trial, but they worked with thousands of women and some of them did become pregnant. And so when we looked at the data, there was a registry for women who had babies. And there were very high levels, Andrea, of congenital deformities for women who got pregnant. So in other words, there would be, the babies would be born with deformities. There was a high miscarriage rate. The shot clearly had negative fertility effects on women who took it. And again, since the HPV vaccines have come on the market, I have met countless women who described to me that for many years they could not get pregnant, or if they did get pregnant, they had miscarriages. From the clinical trials at the very beginning, it was very clear that they had negative effects on fertility.
Let's go through these cases all around the world. We go through this. There is India, Japan, Ireland, Denmark. Can you tell us what happened in India?
Yeah, in India, they did. So the Bill and Melinda Gates Foundation gave money to a group called PATH, and they worked with poor young women in remote areas, mostly young women who were not living with their families. And they basically engaged in fraudulent informed consent procedures where people would sign an X for a girl's name. And many girls died in this process. And many girls were injured. And there was such an uproar in India about this that there was a parliamentary committee that wrote a scathing report about what had been done. And for many years, Gardasil was not permitted into the country. Sadly, that's no longer the case. But the clinical trials there really turned the whole government structure and to some extent the medical structure against the Gardasil vaccine.
We have also Japan, a very interesting case, and they pull back this vaccine.
They did. There's probably a sort of a personal story behind that, although we didn't confirm that. But there were thousands of Japanese young women who they were getting the Cervarix vaccine, the Glaxo one, but they were injured in the same way. Girls in wheelchairs, women with very severe autoimmune conditions. They had protests there in Japan as well. And it was taken off the market for some period of time. And I think that they stopped pushing it in the same way. And in Japan, there was a lot of sensitivity because it's a very insular ethnic group and culture. They were very worried about the fertility effects. And actually in Japan, and we write about this in the book, more than in most countries, there was actually kind of an open debate. They brought in people from outside the country to really debate whether or not it was appropriate for the country to have HPV vaccines.
You already mentioned Denmark case. What happened in Ireland?
Ireland has a lot of pharmaceutical industry there. And so there was a very big push to have children be vaccinated, and the vaccines were being given in the schools. And there were kids who were having severe adverse reactions to the shots. And so again, there were protests by parents with these children. And one girl in particular we describe in the book, she was limited to a wheelchair after her vaccine injuries. And she basically called out some of these people. I actually went to Ireland to a conference and some of the other people who were the scientists, doctors who were speaking out about HPV vaccines came to that conference. And again, not quite sure how much is happening, but many of the countries that adopted HPV vaccines, there's been huge pushback. France, for instance, there was an episode in the last year or two where a young man was vaccinated in school. He fell and hit his head. These shots are dangerous, Andrea. And There's no proof that this prevents cancer. There's absolutely proof that these shots can severely injure and kill people. There is no basis for there to be a mandate for this. Absolutely none. They are not safe. They are not effective. And I know that the Croatian people have stood up against forced medicine in the past. And I would definitely urge them that this is another one that is absolutely worth standing up to, because this is a vaccine that is not safe and it's not effective.
That's why it's important for them to hear you and to read this book. But let's explain it later. There is in Colombia, families were organized there and fight against this vaccine.
So Colombia was very interesting. We worked with some journalists and others, lawyers in Colombia. So again, they were rolling it out in the schools. And Colombia actually had laws against forced medicine, but they were using it again in kind of remote areas for large groups of children. And many of these children all at once would have these severe adverse effects. They couldn't walk. They would have jerking motions. They would be really adversely affected. And so literally parents chained the entrance to the school so that the kids would not be able to get in. And litigation proceeded to the highest court in Colombia. And the court did uphold that there can't be a mandate for these shots.
But we have also one example of Australia. Why did Australia get in this vaccinating early and broadly?
So one of the key inventors of the technology that goes into the HPV vaccine is a scientist named Ian Fraser. He's originally from Scotland, but he lives in Australia. And there's a big pharmaceutical industry in Australia. And in theory, they said that this vaccine was to protect women in the developing world. And women in the developing world are absolutely at greater risk of cervical cancer for many reasons. There's not the same kind of screening. There's more toxic exposure, especially smoke within a house for cooking. But that's not really where they've sold this shot. And in Australia, there was this tremendous pride that their own had been a co-inventor of the shot. So there has been high uptake. There's been alleged science out of Australia about the proof that it's diminishing cervical cancer. I believe that you'll have on a Croatian scientist, Lucia Tomljenovic, who will explain that that is very dubious science. There's really no proof. And in fact, some very important French physicians, the Delapines, have done data suggesting that the rates of cervical cancer have actually increased after the initiation of the HPV vaccines. And I think that's for several reasons. It's in part because the vaccines are probably causing cancer. We know that can happen from the clinical trials, but it's also because basically the screening that was happening, the PAP screening, has stopped. Also, these shots do not prevent all types of cervical cancer or all types of human papilloma-induced cancer. So there's over 200 different types of human papilloma viruses. This targets 9, and not all of them are even targeting cancer-causing viruses. Some of them are targeting herpes kind of lesion type of viruses. So this is really just, it's all about the marketing, Andrea. It's billions of dollars. Our book covers, the pharmaceutical press talked about this as lightning in a bottle, making a market out of thin air. This is all about, the initial marketing campaign in the United States was have your daughter be one less. And as one of the scientists who worked in the clinical trial said, your daughter was never going to be somebody who was going to get cervical cancer anyway. Cervical cancer is not a major cancer in the United States because there was effective screening, and nutrition, sanitation, and other things basically made it not a highly prevalent cancer.
When you already mentioned the United States, just from January, CDC decided to make new reassessment of this vaccine, despite that is already 20 years in the market. Can you explain us in details what they are going to reassess?
Yeah. So when the HPV vaccine, when Gardasil first came on the market in the United States, it was proposed that young people would get 3 shots. And then, interestingly, which almost never most vaccines, they give only more and more. They say you need another booster, another booster. So literally, flu vaccines are every year. COVID vaccines were every 4 months. DTaP and MMR, they would add boosters. So interestingly, they reduced the HPV vaccine doses from 3 to 2. And what happened this month in the United States is that the Centers for Disease Control reduced the recommendation from 2 HPV vaccines to 1 vaccine. And the rationale for that was that in many other countries of the world, they had already reduced it to 1. That does somewhat reduce the risks associated with this vaccine, but many people have been injured or have died from just 1 HPV vaccine. So the fact that it's been reduced is not the end of the story. And I'm very happy that one of the members of the advisory committee on immunization practices, Dr. Retsef Levy, has called for and created a subcommittee to look at the HPV vaccine. And now they have in place a process that every 7 years, every vaccine should be reevaluated. So I'm very hopeful that in this honest reevaluation, more information will come out.
Let's imagine that you have a chance to talk with our Minister of Health. What would be 3 evidence-based reasons that should be paused this vaccine, mandatory vaccine in Croatia?
Number 1, the clinical trials don't look at the endpoint of cancer. It's never been proven to prevent any cancer. 2, it's been proven to cause death in young people. It has been proven to cause severe injuries. 3, it has a very potent aluminum adjuvant in it. And we know that aluminum is a poison. Aluminum is toxic to every human organ, including the brain. Why would we want to mandate that to children?
For example, if you have power for the next 5 years to make, for example, plan to research about this vaccine, about this cancer, what would you fund?
Well, I think you could actually use. I don't think it needs study, Andrea, in the sense that it's not proving to have a benefit and it's proving to have detriment. So I wouldn't invest in research, to be honest with you. But if I were going to invest in research, my very first step would be to compare people who got the HPV vaccine to people in a new clinical trial who got a real placebo. One of the things that Secretary of Health and Human Services Kennedy has said is that all new vaccines have to use true inert placebos, meaning that there's no biological effect of the control. When you have a control that has aluminum in it that's going to potentially cause autoimmune conditions, that's a fake experiment. That is comparing like one brand of cigarette to another brand of cigarette. That's what they did in the Gardasil clinical trials. That's unacceptable. So the other thing is I would just look at young people. Probably in Croatia, there are young people who got the Gardasil vaccine and people who didn't. I would do a thorough health inventory of those people, see what the differences are. I think you'll see some.
And then what could be reason, for example, for Croatia, what could be reason that they want to do this mandatory?
Well, sadly, Andrea, there are lots of incentives from the pharmaceutical industry. There's a lot of money at stake here. So one of the things that I consider to be a terrible conflict of interest in the United States is that scientists in the National Cancer Institute get money from Merck for their contribution to the technology in the HPV vaccines. The U.S. government makes millions of dollars from Gardasil. And it may be that there are similar financial arrangements. The pharmaceutical industry is one of the most, if not the most, powerful global industry. So I feel confident that your Minister of Health is aware of economic incentives that you probably aren't, or the public probably are not aware of.
Yeah, there is in these pages of MSD company, there is a funding inside in Croatia. I published in my Facebook profile and everybody can see how much money they receive from this company, especially this who is promoting now. But just for the end, what is most important question for you? Let's imagine that parents from Croatia can ask you a question about this vaccine and what they should do in case they need to vaccinate their children, where they can find the proof or something that can help them for making this right decision for their kids.
Well, you can certainly come to the website of the organization where I'm president called childrenshealthdefense.org. It was founded by now Secretary of Health and Human Services Kennedy. We have a lot of information on the website about Gardasil, about the HPV vaccines, about the teenagers who've been injured. I also recommend to people, as you mentioned, the book that I co-authored called The HPV Vaccine on Trial, Seeking Justice for a Generation Betrayed. I think if parents look, one of the things I always tell people to do also, Andrea, is go to the product insert. What is the information that the pharmaceutical company gives to the Food and Drug Administration and to doctors? It's called the product insert. That will tell you a lot about the clinical trials, about what has been reported as adverse events. That's another very important thing for parents to read. Parents need to educate themselves. I wish I could tell you that the doctors and the government will tell you the truth, but I don't think you can assume that. So parents need to do their own research. It's too important.
And when we're talking about money, for the end, I want to say that I am not in any kind of conflict of interest. I'm not receiving any money from anybody. I investigate this because I want the truth. What about you?
Same thing. I work for an organization. I have no ties to any industry whatsoever. I am in this because I have a vaccine-injured child. That's how I got into it. And I realized that the world needed more truthful information from people who'd experienced what's really happening firsthand.
Thank you, Mary. Thank you for your work, for your book. And we'll be in touch because I think this topic will be again very hot in the next period in Croatia.
Well, I'm at your disposal. It should never be mandated, Andrea. If people want it and they're adequately informed, it's their choice. It should never be mandated.
Thank you.
Thank you.
Evo, dragi narode, imali ste prilike čuti, toplo preporučam, pročitajte knjigu. I svakom doktoru koji vam preporuča i tvrdi vam ovo što je recimo meni doktorica Neda Ferenčić-Vrban rekla u lice da je 100% nema nikakvih nuspojava, da nisu nikad prijavljene i da se 100% koristi placebo grupa za kontrolu, da pročitaju knjigu i neka vam uistinu pokažu i dokažu da je tako. Naime, ja sam znao da tako i nije čim sam razgovarao s gospođom, ali evo, čuli ste što mi je rekla i čuli ste kad sam nastavio postavljao pitanja da je jednostavno napustila razgovor, proglasila me provokatorom. Naime, upravo su neugodne teme o kojima se mora razgovarati kada su u pitanju naša djeca. Naime, nedavno sam čuo, prije nekoliko dana, kako je gospodin direktor moderne kompanije u jednom intervjuu rekao sljedeće, da je on obavijestio svoje investitore da neće više ulagati u cjepiva, jer zbog nove politike u Sjedinjenim državama oni realno gube tržište Sjedinjenih država i samim tim sva investiranja u razvoj im se ne mogu isplatiti, nema povrata na kapital, to su njegove riječi. Njemu je žao što gubi američko tržište, ali jednostavno se ne isplati onda ulagati. Što govore te riječi? To govore da je nekome ko proizvodi lijekove na prvom mjestu profit. Što ne iznenađuje? On mora opravdati očekivanja njegovih investitora. Međutim, nama i vama i našoj djeci na prvom mjestu je njegova sigurnost i zdravlje. I nas ne treba biti briga za njihove profite, niti za njihov povrat na kapital. Dakle, to je njihov problem. Mi trebamo brinuti o sigurnosti onoga što uzimamo za našu djecu i za sebe. Stoga trebamo voditi računa o stvarnim informacijama, a ne o marketingu. Ja sam također i objavio, imate na stranicama MSD kompanije, u kome oni objavljuju koliko novaca daju za razvoj u Hrvatskoj, koliko daju pojedinim doktorima, koliko daju pojedinim organizacijama i objavio se da su u pitanju 100.000 eura kad su u pitanju organizacije, a milijuni eura samo u 2023. i 2024. za razvoj. To ide direktno doktorima i znanstvenicima, što je sve legalno, zato i objavljuju. Međutim, moramo si postaviti pitanje, da li je moguće da netko tko prima novac od te kompanije za razvoj može biti objektivan prilikom ocjenjivanja da li je taj proizvod dobar ili ne. Mislim da je odgovor svima jasan. Kako biti objektivan kad si u sukobu interesa? mi jedini koji imamo djecu i koji trebaju primiti te proizvode, trebamo i možemo biti objektivni zato što nam je interes zdravlja naše djece na prvom mjestu. Nadam se da ste danas mogli puno toga čuti, dovoljno da istražite dalje. Ja ću i dalje ostati o ovoj temi. Ide uskoro i sljedeća emisija u kojoj ćemo još više ulaziti u detalje ove teme. Tako da vas informiram, jer ove informacije nećete čuti u ovim tradicionalnim medijima. Mislim da razlog ne treba ponavljati. Jasno je da se tradicionalni mediji već duži niz godina bave propagandom, bave se marketingom, jer jednostavno neko treba pokriti troškove. Ja u ovom slučaju nemam nikakav financijski motiv, nego jedino istinu, jer me zanima zdravlje svoje djece i vaše i zanima me istina. Stoga potrudite se sami saznati, istražiti, provjeriti sve ovo što sam ja rekao i što je gospođa Mary Holland napisala, pa na kraju krajeva, iako je netočno to, možete mi pisati i ja ću objaviti sve što napišete, naravno ako mi ponudite za to i dokaze. Nadam se da ste bili zadovoljni sa današnjom emisijom i uskoro se vidimo u sljedećoj epizodi podcasta Slobodni.
Nitko vas neće natjerati da se poklonite zvijeri, učinit ćete to svoje voljno, odbacujući vjeru. Bićete laka meta za zvijeri, jer se niste podredili vjeri. Ako se ne podredite vjeri, podredit ćete se zvijeri. Toliko ćete se suobličiti sa ovim svijetom, da nećete ni prepoznati da ste u zabludi. Biće to najveća demonska prevara ikada i pravedno zaslužena osuda nad nepokajanim grešnicima.
Gdje su svi?